Let's demonstrate the features of radius now. Radius is the preaxial bone of the forearm and it's an example for typical long bone. Radius is divided into following parts. It has an upper end, it has a lower end and it has a shaft. We will talk about the shaft now. The shaft of the radius is divided into 3 borders and 3 surfaces. Let's try to identify them. The most prominent border is the interosseous border or the medial border, and it is very sharp as we can make out. Then it has an anterior border which is a rounded and oblique, and then we have a posterior border. The posterior border is again very prominent only in the middle of the shaft. In addition to this, there are 3 surfaces. The surfaces include the posterior surface, the lateral surface, and then we have the anterior surface. The anterior border, as I mentioned, is round and oblique. In between the anterior border and the medial border, there is anterior surface. The anterior border in its upper part gives attachment to the radial head of flexor digitorum superficialis. That is the only important attachment to the anterior border you must remember. When we talk about the medial border, it is also referred to as the interosseous border because this gives attachment to interosseous membrane which connects the radius and ulna, forming the middle radio-ulnar joint, a type of syndesmosis. When we come to the posterior border, as we can see, posterior border is again well defined only in the middle. What about the surfaces then? The radius has 3 surfaces. The first surface that we should learn is the anterior surface. The anterior surface in its upper 2/3 gives attachment to flexor pollicis longus muscle, which is one of the unipinnate and deep muscle present in the front of the forearm. In its lower 1/4, the entire anterior surface gives attachment to the pronator quadratus muscle. In addition, there is one important feature that you must notice here. Can you observe this nutrient foramen? The nutrient foramen of the radius is directed upwards, suggesting that the upper end of the radius is the growing end. Right? So this is regarding the importance of the nutrient foramen. Right. Once we have learnt about the anterior surface, let's see what exactly is the lateral surface. The lateral surface lies between the anterior border and the posterior border, and in the middle, as we can see, there is a roughened area. Now this roughened area is for insertion of pronator teres muscle. Remember, pronator teres arises from the medial supracondylar ridge and gets inserted here, and this is one of the chief pronator along with the pronator quadratus that is attached to the lower part of anterior surface. Just above the pronator teres insertion, we have one more roughened area on the lateral surface, and this is for the insertion of the supinata muscle. So both pronator and supinator are inserted here, right? Fine. Then what about the posterior surface? The posterior surface actually lies between the posterior border and then the interosseous border. The posterior surface gives attachment to abductor pollicis longus in its upper part and extensor pollicis brevis in its lower part. Both muscles are the extensor muscles of the back of the forearm. These are some of the important attachments that you must remember for the shaft of the radius. Once we have learned this, let's learn about the features of the upper end of radius. Upper end of radius has a head, then a neck, and then the radial tuberosity. The head of the radius articulates with the capitulum of the humerus, forming the humeroradial joint. The peripheral margin of the head of the radius gives attachment to annular ligament, and this articulates with the radial notch of the ulna, forming superior radio-ulnar joint, which is an example for pivot type of joint. Then when we talk about neck of the radius, the neck of the radius gives extension to attachment of annular ligament. The radial tuberosity is a prominence seen along the medial border. This area gives attachment to the tendon of biceps brachii. These are the important features of the upper end of humerus. Remember, there is an important clinical condition called as pulled elbow, which is seen especially in children. This occurs due to slipping of the head of the humerus from the annular ligament. When a child is held with its elbow pulled up, This part of the radius usually comes out of the annular ligament, resulting in subluxation of head of the radius at superior radioulnar joint, and that is what we refer to as pulled elbow. The importance of knowing neck of the radius is this is the level where the brachial artery terminates into radial and ulnar arteries. So these are some of the important features you may want to remember regarding the head of the radius and the entire upper end. Let's learn about the features of the lower end of radius now. The lower end of the radius has 5 surfaces: anterior, medial, lateral where we have the styloid process, then posterior, and then inferior. The anterior surface is clinically important because against the anterior surface of the lower end, we palpate the radial artery lateral to the tendon of, can you tell me which tendon? Lateral to the tendon of flexor carpi radialis, right? Correct. Then what about the medial surface? Medial surface, as you can see, has an ulnar notch, and the ulnar notch articulates with head of the ulna, forming inferior radioulnar joint, which is again a pivot type of joint. Then when we turn to the lateral surface has an elongation, and this elongation is called as the styloid process, right? Then when we turn posteriorly, we have the posterior surface, and posterior surface has the dorsal tubercle of Lister. This divides the entire posterior surface into 2 distinct areas. Now lateral to the dorsal tubercle of Lister, we have the tendons of extensor carpi radialis longus and extensor carpi radialis brevis as they pass from back of the forearm to the dorsum of the hand. Then medial to the dorsal tubercle, we have the tendons of extensor digitorum, then we have the tendon of extensor indicis, and then we have the tendon of extensor pollicis longus along with posterior interosseous nerve. These are 4 structures which are related to the area medial to the dorsal tubercle. These must be remembered because when we discuss about the extensor retinaculum of the rest, this forms an important relation. This is regarding the posterior surface. When we talk about the inferior surface, so let's see about the inferior surface now. The inferior surface has 2 facets. The lateral facet towards the styloid process is for the scaphoid, and the medial facet is for the lunate bone. This is regarding the features of the lower end of radius. Let's learn how to identify the side of the radius. In order to identify the side of the radius, identify the head and place it above. Identify the lower end by the presence of styloid process and keep it below. Now the giveaway clue is the medial border which is sharp, that is the interosseous border, and also the dorsal tubercle of Lister. This should always come on the posterior aspect, right? So when we satisfy all these criteria, we get the side of the radius. This is the right sided radius and this is the left sided radius, right? So we have the upper end, we have the lower end along with the styloid processes, we have the radial tuberosity which is directed medially, we have the interosseous border which is directed medially again, and we have the dorsal tubercle of Lister which no longer can be seen because it is in the posterior aspect. And once you identify the side, hold it with the same hand to which it belongs. That will give you the anatomical position of the radius.